Right, good afternoon, everybody. Thank you very much for your time. Today we're doing a webinar launch of our report from our roundtables in November on the future of social care. The roundtables came about obviously with the new government in place and some conversations with the Care Minister, who suggested that if the sector and different stakeholders wanted to feed into the potential social care reform, then he welcomes ideas from the sector. Therefore, we organized 5 roundtables. The first one was with just care workers, so no other stakeholders there, to give care workers the space to be able to speak freely. And then we had other 4 roundtables on different topics with other people. And today with me, I have 2 of the people that attended our roundtables and that are part of our advisory board and champions project funded by the RAIN Foundation. We have Elizabeth and Idris. Hello, and thank you very much for joining us. So what we're going to do is put up some slides now, and we're going to talk to you about the report. And at the end, there'll be some time for questions. Thank you, Keely. I hope everybody can see my screen. There you go. Lovely. So, like I mentioned, future of adult social care. We had an illustrator join us for all of the sessions to try and capture the conversation in a bit of a different format. So, as you can see, some of the things that have been said during roundtables were around welfare standards for care workers, that care workers are part of people's lives, that the work is very varied and rewarding, that care workers are preventative care, and that training should be paid for example, consistency is key. So a lot of different themes have come into it. Kitty, if I could have the next slide, please. Thank you. So in terms of making the voice of care workers heard, this is at the heart of what we do. Like I mentioned, we started a project with the RAIN Foundation last year, where they're supporting us with funding to actually pay for care workers' time, for the participation, to pay them as experts, to pay for the travel time, etc., and make sure that they can engage in as many different activities as possible. It is all about a shared vision for social care. So not just looking at one side, for example, a provider, a person who draws on care, or a care worker, but bringing it all together. We wanted to make sure that it talks about elevating the care workforce in terms of the important work that care workers do, and social care being a very distinct sector, separate from the NHS, a sector in its own right, not just a Cinderella service to healthcare. We've included links to some different reports in our report to make sure that we're building on existing work and referring on it, not just repeating what's been done already. And obviously, it's all about sustainable funding and investment, and that's been talked about a lot, and valuing care in society. And that was very much, I think, a key theme running through all of our roundtables. What is the value of social care? And that it is underestimated by governments, that is underestimated by the society. Can I have the next slide, please, Kiri? And in terms of roundtables, as I mentioned, we held 5, one exclusively with care workers, other 4 with a diverse stakeholder representation. We had people from local authorities, from think tanks, from Skills for Care, all over the place, care providers, just to make sure that we had a variety of voices there. We made sure that the roundtables were as accessible as possible, and we held them online and giving people as much notice as we could. We had a dedicated space for care workers in terms of the first roundtable, but we also had care workers in each other of the care roundtables, and it was a collaborative space and shared understanding that everybody has a right to their own opinion. People don't always have to agree, and that people's minds can be changed. And we saw that during roundtables themselves. So we discussed a variety of topics from fair pay and training to the National Care Service in the context of if any future government decided to go ahead with the National Care Service in England, what would people want from that National Care Service? Or in terms of pay, we're talking about potential of what should be included, what people should be talking about around the fair pay agreement that obviously government is currently working on. So that's it from me, and I'm going to hand over to Elizabeth now. Oh, Elizabeth, you're mute. No worries.
Hello, sorry. My name's Elizabeth, and I'm an adult care worker in the adults with learning disabilities sector. Um, I have been asked to talk about some of the roundtables and what came across in them. So here goes. The adult social care in England, where we are now. During the roundtables, we had full and frank discussions on this subject. Everyone passionately felt that reforms were needed, and some felt urgently within our sector that we require a North Star or vision to guide reforms and define success, that this should be accessible and reflect the diversity within the care sector and voluntary unpaid care workers alike, that we should move forward from the time and task framework, which was dropped years ago from the nursing model, in favour of a more holistic, whole patient, collaborative approach, and that we need to highlight the transformative role of care in enabling individuals to lead fulfilling lives with dignity and autonomy. There was a consensus that social inequalities are reflected in social care, both in the ability to recruit staff to a dynamic sector that makes such a difference to people's lives, when they can earn the same in a supermarket with probably benefits and sick pay. These social inequalities are also shown in the general public's ability to access life-changing care that can be a postcode lottery and depend on many criteria and turn of the dice. At its best, the National Care Service was imagined as delivering sector identity and belonging, which would in turn increase morale and job retention. Point 2, a clear workforce pathway, improved pay, career progression and training, which was not variable by employer. Point 3, elevated status and visibility, a means to raise the status of care working and the sector as a whole. A national oversight with local flexibility that balances national standards and local adaptability to best meet people's needs that are having to draw on care. And lastly, a focus on social and social care enabling individuals to live fulfilling, relationally rich lives. A humanistic approach will be essential, prioritising relationship respect and the agency of care workers and people drawing on care. And if I may add, elevating these groups of people within society for and as part of the greater good. Because I ask you, what sort of society does not value those who have reached a point where they may require care or those who provide it? The Roundtable recommends that there is a rethink of government understanding of the sector. Policymakers must view care as critical. A people-centred service that supports lives and community, not just a series of tasks or costs to be managed. We must foster a public respect and understanding. On a personal note, in my work as a domiciliary carer and adult with learning difficulties support worker, I have cared for people from all walks of life, from farmers, RAF colonels, CEOs, professors, doctors, nurses, teachers and retail workers, to name a few. All of these people have received great care from me, fostering mutual respect and enabling them to live the fullest lives possible. The government and public should remember disease, dying, ill health, and any need to call on the care service does not discriminate between peoples. We must respect the essential role care workers play and recognise the humanity and autonomy of people drawing on care. And finally, recommendations are that we reframe the care sector as built on relationships and respect for both co-workers and those who draw on care, highlight the value of care and supporting people to live with dignity and independence, discarding the outdated narratives of task-based transactions to find out more, or for more information, please look into Changing the Story of Adult Social Care, funded by the Rainey Foundation. Thank you.
Thanks, Elizabeth. And Idris, could you do your part now?
Good day, everyone. My name is Idris. I am a care and support worker specializing in supporting adults with mental health challenges, learning disability, and at the same time, I work with adults who require extra care and support. I am a member of the Care Worker Advisory Board of the Care Workers Charity. And today I will be discussing about the report findings about fair pay and its importance to care workers. And I'd like to quote one of the care workers at the roundtable who said there are stigmas surrounding care work. It is a skilled role with the range of things we have to do. I would be doing stomach care and nurse catheter care. And I would like to continue by saying, as proven over time that care work is an highly skilled, responsible, and socially vital profession, it remains one of the most undervalued and lowest paid sector in the UK. This report was able to find that 43% of care workers earn below the real living wage. And during discussion, care workers expressed frustration of being perceived as low skilled despite the significant expertise and responsibilities that Javo required. Care workers also highlighted the as they were. They said that care work include the following: administering medication, handling delegated health tasks, activities planning, training others such as shadowing, cooking, companionship, advocacy, and many much more. Care workers during the discussion made it clear that there is no fair compensation when these tasks go beyond their care roles. And during the discussion, they were able to arrive at a point whereby they can have a cap payment of £15 per hour, and that move up to as more as up as you go in in your promotion and the rest. And during the discussion, care workers were able to highlight recommendations that they think can be implemented in the National Care Service. The recommendation include establishing a national minimum pay standard for care workers, introduce pay progression models, um, which include more pay when promoted. So when a care worker is promoted, more pay should be visible. Recognize the value of care. There was strong support for a cultural shift to the value of care appropriately. Participants called for wages that reflect the complexity, responsibility, and skills required in these roles. They stressed the need to move beyond minimum rates and take bold action to ensure care workers are fairly compensated for their critical contribution, and as well as respect from other professions. And care workers highlighted the need to be respected by other professions, as it is very important because they also impact the care sector and they also impact the life of people. So they say that it is very important that they receive respect from GPs, respect from paramedics and other health and professionals, and at the same time, a more and more reflective pay to the job that has been carried out by care workers across the UK. Thank you.
Thanks a lot, Idris. And back to you, Elizabeth.
Hi, so the Fair Pay Agreement beyond wages. This was the next kind of segment that made up our discussions. The roundtable was made up of other people like me who care about people and about their jobs. They take great pride in doing things right and enabling people who are drawing on care to have the best life as possible. They emphasised in their discussions the importance of a fair pay agreement that extends beyond hourly rates, and to look at issues including unpaid travel and training time, lack of adequate sick leave, no or minimal pay progression, limited or no benefits, e.g. pension, insufficient compensation for unsocial hours, car maintenance and insurance, and a poor work-life balance. There were other things that I'm going to share now also. There are many shared experiences of earning less than the advertised rate for a job once travel times were factored in. Mileage rates, for example, often failed to cover wear and tear or insurance or other things pertaining to own a car in rural areas. And in cities and urban areas, the high cost of public transport was talked about. People spoke, for example, during COVID and following years and years before that, having to choose to go into work as the sick pay was inadequate or non-existent. And also the short staff issue would leave people without care. So felt a moral obligation to attend work. Sick pay currently starts at, I believe I've got these figures right, £116.75 per week, rising to £118.73 in April 2025. Far below what most full-time or even sometimes part-time carers earn a week, leaving them financially vulnerable if they fall ill. Roundtable participants also talked about not being paid for training and being expected to do it in their own time, especially online training. Now, I have many friends in different work sectors, different walks of life, and this has never, having asked all of them, been expected of them. Having to work unsocial hours for no extra pay, for example, weekend shifts often being mandatory. Stated in the job descriptions, yes, when you're eager to start your new career, but no mention of no uplift or ability to negotiate. This can be shown pertinent to those who are, for example, living carers, whose rights and ability to have kind of a framework around their pay, very sketchy. And also people on sponsorship who might not be able to negotiate the hours once in this country. Honestly, everybody needs time off. All those people who are in office-based or jobs or managerial jobs certainly require it, and so do frontline carers. We also spoke about barriers to progression. For example, a lack of financial incentive as to be a shift supervisor sometimes garners as little as 20p extra an hour for such great responsibility. The incentive is hardly there for those people who show great potential to progress for the extra responsibility. Another barrier which we spoke about to fair pay and career-wise was the lack of remuneration for being a highly skilled worker. This could be seen in general, as most carers have to be highly skilled these days. However, it can also be seen in my life, for example, as a qualified nurse, having a degree and also having kept my training up to date throughout my care career. I could be seen as a highly skilled worker, as opposed to someone just starting out in the field of care, for example. However, I receive no extra remuneration for this or financial incentive. Essentially, we decided it was important to make the already valuable and valued members of the care sector incentivised and excited to career progress, and that the Fair Pay Agreement and governing body would both feed into this. Thank you.
Thank you, Elizabeth. Sorry, I got chucked out of Zoom. Are you finished for now?
Yes, I am. Yeah, thank you.
Right, Idris, if you could go to your next bit, please.
Thank you very much. Moving forward from fair pay, care workers highlighted the importance of training and development during the discussion at the roundtables. As care workers present at the roundtable agreed on the benefits of the National Care Service, they also highlighted the importance of adequate training for care workers within the National Care Service. Care workers present at the roundtable said that it is important that people receive pre-job training to help them prepare for the realities of the care workforce. They also said that there should be a sustainable career pathway for those who aim at progression, and adequate training should be given and made available to those individuals. Care workers during this roundtable and discussion also voiced the need for training not to be gatekept any longer, and access to training should come with less struggles. Lastly, participants emphasize on the importance of more technology use in care, as this can broaden their skills if effective training are given to care workers on how to use those technologies. And during this discussion about workforce training and development, care workers came up with some recommendation that they felt is very and will be very important. Care workers recommend that training that prepares them for their current roles and training that facilitates career progression should be made available to them. Care workers also want progression pathway that reflect their experience, diverse interests, and skills as seen and used in the NHS. Care workers also spoke about a skill passport, could provide a system to track and transfer training record, progression pathway that reflect experience. They also talked about registration and professionalization. During the discussion, there was strong support among care workers for creating a professional registry and care worker body. Importance of maintaining flexibility for individuals drawing on care to choose their preferred care workers. Some concerns about the implementation of a professional registry is currently unregistered, is a large currently unregistered workforce. Benefits include sense of belonging for care workers, advice, support, and guidance, would elevate the sector, improve career prospects, and enhance the quality of care. And during this discussion as well, there was a strong foundation in existing frameworks, such as the Department of Health and Social Care Workforce Pathway and Skills for Care Workforce Strategy. Care workers sense that it is important to build on this rather than starting from scratch. However, a gap exists in awareness among care workers, indicating the need for improved communication and engagement. Thank you.
Thanks a lot, Idris, and thank you very much, Elizabeth, as well. I really appreciate you both presenting our report on these roundtables. So just in terms of the key findings and, you know, the main themes that came through over the 5 meetings that we had is that without tackling the funding, there is very little hope that any reform would succeed, and that the government really needs to look into funding social care properly and at the levels that are sustainable, at the levels that pay care workers a fair wage for the work that they're doing. And it seems that commissioning practices often prioritize cost over quality. And we had a very in-depth conversation about commissioning, and that it is commissioning that is often the problem and the reason for why care workers are paid so little, especially in the services that are mainly local authority funded. Annual budget cycles are very unhelpful in terms of sustainability of services, in terms of planning, in terms of development of skills and training for care workers, and that some care providers have to withdraw from contracts and are looking at potentially withdrawing from more with the national insurance increase coming very soon. So just looking at all of the roundtables together, first of all, I want to say that it was incredible to have so many care workers voice their opinions and be part of the conversation and give examples from the work that they do every day to other stakeholders and to help people understand things differently or look at them maybe differently as well. It was very good to see how many different people and different organizations, type of organizations wanted to engage with this conversation. I think it was very clear that people are worried about the state of social care right now, about what's to come, but that everybody is very dedicated to social care. And with people being so dedicated, we also need the government now to be dedicated to social care, with dedicated funding streams, with dedicated reform, with an understanding how important social care is. Can I go to the next slide, Keely, please? There was a couple of recommendations that came very strongly from the care worker roundtable that maybe there wasn't as much agreement on with once we included other stakeholders, but we really wanted to talk about them here. So one is about the registration of care workers in England. Care workers during their own roundtable felt that it would help elevate the workforce, would help people again have access to better pay, conditions, training, etc. And also around the professional body for care workers as a place for care professionals to belong, as a place to go and gain a training, advice, support, governance, education, and to advocate for them as well. So those are the things that came up during roundtables. Obviously, that was just the beginning of the conversation, which included as many care workers as we could really find for that time. We want to continue those conversations with care workers, we want to continue those conversations with the stakeholders, but I think the main message for us is also that we need to be having these conversations together, not just in our own silos, because it is the silo thinking or people being competitive about who started which initiative, etc., that really gets in the way of reform, because it's potentially taken advantage of by policymakers. There is definitely a strong aspiration for a social care system that values dignity, autonomy, and well-being, but we have to remember that it's dignity, autonomy, and a well-being not just for people who draw on care, but it has to include care workers as well. People working in social care really enjoy the work. There's no question about that. They find it very rewarding, but they do feel that they're not rewarded in terms of money for it properly. To achieve better social care in England, there is the need for collaboration and investment and proper systemic change. A couple of £1 million from the HSE every now and then is not going to fix it or make it better. It needs to be a proper long-term plan that includes all of the stakeholders, and that includes vast amounts of funding. Going back to funding, resource allocation, and workforce development will be absolutely and are essential in building a robust social care framework, and they have to be considered. And there's often that saying, care workers don't help people just survive, they help them thrive. We talk about care workers supporting lives of other people and helping people live the lives they want to live. I think from the Care Workers Charity, we want care workers to live the lives they want to live, because care workers, as much as people who they support, have a right and should have that. And it is rather heartbreaking hearing the stories of people who give their all to support lives of others, struggling in their own lives. And we see that a lot in our grant giving and in our work. Just to close the presentation, I first of all wanted to thank all of the care workers that participated. I want to thank again Idris and Elizabeth for helping me present it today. I want to help all the other stakeholders who agreed to participate and share their opinions and views and experiences. And I want to thank you all for being here. We have a bit of time for Q&A if anybody has any questions. And let me just have a look at that. Elizabeth and Idris, is there anything you'd like to add? If you do, just come off mute and talk, please. Nope, that's absolutely fine. Olivia, do you have any questions?
No, I was just going to say that I can be here to ask the questions from the chat to the panelists. And I thought I would show some of the feedback that we've had so far whilst we're waiting for the first few questions to come in.
Yeah, that would be great.
So,
thank you.
Sophie has said, such incredibly good work conducted by the Care Workers Charity and care workers. Very informative work. Well done all, and thank you. John has said, I think the graphics are excellent, as is the overview and analysis. Well done to all of the participants. We also have Agechi saying, I love the efforts of the Care Workers Charity. This is really commendable. Hannah has said, fab job, Elizabeth and Idris. Holly has said, brilliant presentation of clear and vital recommendations. Thank you all at CWC. We have got a few more bits of feedback, but we have got our first question through that I'm going to ask to the panelists. And the question is, how do we coordinate to ensure we have one voice?
I'm going to start, and then I'm going to see if Elizabeth and Idris want to come in on this as well. But I think giving everybody an opportunity to have a voice in the first place. We had a conversation this morning, didn't we, in our advisory board meeting, that care workers are often not given a voice. So to have one voice, first of all, you have to give everybody a voice to participate. Elizabeth and Idris, anything to add in there?
Yeah, in regards to having a voice and us coming together to have a voice, as you can see, the care workers charity is really helping care workers to achieve that, and thereby implementing the care worker advisory board, the care workers champion as well. So just trying to create a way where we can co-produce and come together and let our opinions be heard, and those opinions can then be passed towards the policymakers. So the main thing is us coming together and having these discussions and sharing our opinions, and at the same time changing our mindset and also learning more from each other, and that can allow our voice as one when we are discussing and dealing with the policymakers. Thank you.
Elizabeth, anything you'd like to add?
Just that before I'd heard of care workers charity that I had to call on myself for help, I didn't realise that there was this kind of ability to be part of something that's driving forward positive change. So I think that the surveys and things like that, for example, are brilliant to ensure that the word gets out there and that people are all aware. Does that make sense? Yeah.
Thank you. I can see a few more questions popping up. So in terms of getting this in front of policymakers and the government, yes, it was emailed to the government, to the minister, to civil servants at the HSC yesterday, and we're encouraging them to have meetings with us to discuss it. In terms of government's commitment to National Care Service, I don't know. We had these discussions around a variety of topics, including training, pay, and the National Care Service, in case that's something that the government decides to go ahead with. But I've not had any definite updates, and I'll find out at the same time as you all, probably from the media. And then was there anything else? Yes, we will be sharing it with the independent commission, with the Casey Commission. Definitely we'll be emailing it, and we're also trying to get an opportunity to speak directly to the commission as well. I think that covers the questions, Olivia. Oh, in terms of bringing forward the date of the National Review of Social Care, I think the Baroness Casey Commission and then the Fair Play Agreement negotiating body, etc., at the moment are seen as the review, and I don't see anything else happening at the moment apart from the Casey Commission. We always campaign for review of social care. We always campaign for reform of social care. But I think those activities in place at the moment are what the government has planned.
Just to note as well, there was a question earlier from John that says, is there a time frame for this? Now, I don't know if he means social care reform or the report recommendations itself.
There is no time, like we cannot dictate a time frame. We can make recommendations. Time frames are with most of the recommendations here are very much down to the government reform and funding available. If we could ask, we'd say tomorrow, but that's a very unrealistic timeline. So no, we haven't put any timelines in there. There is another question around what can be done to have one professional register for care workers. Well, it would have to be mandated by the government and required by the government to do that. I think otherwise any other voluntary register is not going to have I think the authority that it is needed to have in place. Elizabeth and Idris, is there anything you'd like to ask about, add about roundtables themselves, or anything else at all? Any of your own opinions?
If I can just, yeah. So the roundtables were one of the first places I really felt heard. Like I feel valued from the care that I give to people by other people, not always, but mainly. I feel valued and I feel respect and I feel like I get something back. But in terms of being heard, the roundtables were the first time I really felt that. So I think it's really important, been a really important journey for me and one that I really, really honour. Yeah, and so thank you. That's all.
Thank you, Elizabeth, and you always make me cry. Idris.
Thank you. Just like Elizabeth said, I feel like the roundtable was very, very enlightening and same time informative because as care workers mostly we don't really say much at work or to the media. We're not like the sector that really talk much to the public. But I feel like this roundtable has really given us insight on the issues we're having and at the same time allowed care workers to share opinions and to like create ideas and recommendation on what they feel needs to be done. I know that we have the care workers week whereby we have care workers coming together, but I mean the care workers week is more of business owners or owners of care businesses that are mostly there. But this roundtable is has created a way whereby care workers are involved in the discussion, and this our discussion can then be handed over to government and over to those who really matters. And that is very, very important. And I hope we continue to have this discussion and this discussion continues to grow. And at the same time, we see results, positive results from these conversations. And hopefully the government you know, listen to us and do what's right for care workers and for the care sector at large. Thank you.
Thank you very much. And I'm seeing lots of very lovely comments, Elizabeth and Idris, about your presentation and your participation. So thank you again for doing this. Olivia, do we have any more questions or are we? I think that's it. Well, thank you very much, everybody, for your time this afternoon. We'll have the report on the website at 1 o'clock. We're very happy to have calls with anybody who'd like to have further discussions. We encourage anybody interested in doing any work in social care to make sure that you involve care workers in that. And we are also happy to help facilitate that. So thank you very much. Thank you again to Idris and Elizabeth. Thank you very much to Olivia and Kitty for all of your work with the advisory group around the roundtables and on the report, especially Kitty on the report part. And yes, have a lovely afternoon, everybody.